Hello, I'm Dr. Elizabeth Roy. Thanks so much for joining me. I want to chat with you about the vampire facelift. This is a very exciting procedure that I've been doing in my office now for the last 2 years, quite successfully. My patients are very happy with it, and I'm very excited to say that it has been gaining some notoriety. As you know, Kim Kardashian had the vampire facial, not quite the same as the facelift, but the celebrities received a vampire facelift as a gift in their swag bag at the Academy Awards, so that was exciting. But I want you to know that this procedure is not just for celebrities. In fact, it's an excellent office procedure and quite affordable with phenomenal benefits. Here's what it is. It's a combination of hyaluronic acid fillers, things you're familiar with, like Juvederm, Restylane, Perlane, injected strategically and artfully in combination with platelet-rich plasma, which is derived from your own blood. Now, Dr. Charles Runnels trademarked this procedure for one reason, and that is to try to maintain an artful aesthetic approach when applying both of these technologies. And as you know, I've been practicing aesthetic artistry now for 8 years, and it's so different from just your corner side injection of fillers in the nasolabial folds or, around the mouth area. When you look at the face artistically and the goal is to restore a youthful look, it's much more than just filling lines. And that's what this vampire facelift is. It is a specific way of applying these technologies. So, dermal fillers restore volume. The first thing we do is evaluate the shape of your face, where you've lost volume. What is it that's making you look older or tired or just not yourself? We then inject the dermal filler to restore the shape, and it works very effectively, as you know, followed by the PRP, which is platelet-rich plasma. The first thing that I do is draw your blood. I spin that blood, and the top of the tube is a yellow serum, and that's called platelet-rich plasma. It's filled with growth factors and healing factors that I then activate and inject back into your face. Now, normally, when there's any trauma at all, when you hurt yourself, the platelets are activated within your body. They then arrive at the scene and they do their job to repair and to rejuvenate tissues. That's what they do. And so we're able to use this technology in the aesthetic studio. And it's a beautiful thing. Platelets rich plasma has been used successfully in dentistry for a couple of decades now. I have a cosmetic dentist in my practice who says that she would be unable to do the reconstructive work that she does successfully without platelet-rich plasma and its stem cell rejuvenating properties. We are using platelet-rich plasma in orthopedics to inject and repair joint damage. We're using it in wound healing. In fact, Yale University just published a paper that touts the benefits of platelet-rich plasma in wound healing. And that's what it does. It stimulates healing. And so you can imagine how effective it is when we use it in the face. We stimulate new collagen. We stimulate new blood flow. We get improvement in the texture of the skin and the color of the skin and the firmness of the skin. And it takes a little time. So you restore the shape with the dermal filler. That's immediate. After about 3 weeks, you start to see the glow from the platelet-rich plasma. And then it's even better at 3 months. And it continues to take effect over the next several months. It helps to make the filler last longer. You're developing your own collagen as the filler starts to degrade, and so you're always left with a rejuvenated look and better texture, better skin quality. So we really truly are anti-aging the skin. We're restoring a more youthful you with the filler immediately, but we're rejuvenating and anti-aging the skin with the platelet-rich plasma, which is just right up my alley. So I'm very happy to see that it's gaining notoriety. I hope that you'll consider the procedure to achieve your aesthetic goals. I'd love to see you here at the office for a consultation. We'll talk about your challenges and put together a plan that makes sense for you. Thank you. We'll see you soon.